Hey, Dr. Joe here. So this is essentially a public service announcement. If you're taking a supplement with iodine, I want you to strongly consider stop taking it. I want you to consider throwing it in the garbage. And I want you to consider, if you have a receipt and it's unopened, taking it back. So many individuals right now during this Omicron explosion and during this entire pandemic have been looking for ways that they can boost their immune system. And one of the common conversations out there is related to at-home supplements a person can take to boost their immune system. And one of the most popular ingredients in products that people take is iodine. And taking iodine in excess of what's considered the recommended daily allowance, which is roughly 150 micrograms, can actually cause thyroid disease and thyroid autoimmunity within weeks or months. Taking taking iodine in excess can cause thyroid disease and thyroid autoimmunity within weeks or months. So where did this all start? A colleague of mine asked me about a particular supplement. Okay. Now, my colleague mentioned to me that this product was being marketed as something that a person could take if they had COVID to help them stimulate their immune system to avoid, death and serious infection, which sounds really great. And first of all, so I followed up with a nurse colleague of mine who actually works in a critical care unit and since the entire pandemic. And, it's an N of one, right? So she's not speaking on behalf of the entire nursing association. Okay, but I asked her specifically, have you ever used iodine in a case of acute COVID as a life-saving measure? And the answer was no. So there's that. Now, this particular supplement has zinc, iodine as a particular isomer of iodine, that's a nanoparticle, and then MSM. Now, you can see here that it says 15 milligrams, which is 9,999% the RDA, 10,000% the RDA. Okay. So why is that a problem? As we're going to see, there's some good research that iodine actually is useful in infectious disease. And as we're going to see, there's some other research that iodine could be potentially significantly harmful as a long-term strategy. Okay, so let's just take a look at what I'm talking about. So I went to this particular company's link about it, okay? And so here it says, iodine is recognized globally by the United Nations. This is the 9th reference, and Food and Nutrition Board, the 10th reference, that supplementation has an essential action on the immune system, which is true. Okay, leukocyte myeloperoxidase uses iodine in cell-mediated immunity, okay, which is a type of immunity that our body will take on. There's different types of immunity. This is one aspect that gets supported by iodine, okay? There have been many historical reports of immunodeficiencies among populations of iodine-deficient people. So they're saying, wow, okay, so iodine's super helpful. And there's been a lot of reports that iodine is a problem if it's deficient. So I followed this link down, okay? And so micronutrient deficiency causes morbidity and mortality. That was written in 2003. Okay, I followed this link down, 9 and 10. Okay, number 9 was written in 1989. Okay, malnutrition and infection. Okay, and number 10, another one about iodine deficiency was written in 2001. Okay, and so there was another paper that they quoted here that was actually written in 1961. Okay, here it is. Iodine in medicine and pharmacy since its discovery. Okay, so I went and read that paper. It's actually a fascinating paper written in 1961. So here we are in 2022. And so what do we know about iodine and autoimmunity, or iodine and thyroid disease? So let's just kind of keep going here, figure this out. First of all, what are some symptoms of hypothyroidism or hyperthyroidism? And so the reality is, like, if you are depressed right now, and if you're constipated right now, and if you're losing hair right now, and if you got cold hands and feet right now, and that wasn't something that you had entering the pandemic, and this seemed to have started after the pandemic, and you're just chalking it up to not working out as much, or working from home, or basically staying inside, or just being really anxious about your loved ones getting sick and all of that, or the economic hardships associated with what's going on, or the uncertainty in the world, that would all make sense. However, it's quite possible that if you started taking supplements to help yourself, it's possible the supplements are actually contributing to the problem. So, for example, this is just a screenshot of a form that I have patients fill out or clients fill out. And so section 15 here are symptoms of hypothyroidism, and section 16 are symptoms of hyperthyroidism. Okay. So tired and sluggish, cold hands and feet, these are hypothyroid, meaning reduced thyroid symptoms, require excessive amounts of sleeps to function properly, increased weight gain, even on a low calorie diet, so they can't lose weight, gain weight easily, difficult and frequent bowel movements, so constipation, depression, lack of motivation, morning headaches that wear off as the day progresses, outer third of the eyebrow thins, thinning of hair on the scalp, face, or genitals, or excessive hair loss, dryness of the skin or scalp, mental sluggishness. Those are some really common symptoms of hypothyroidism. This particular person has 2 symptoms that are all the time and a few symptoms that are sometimes. Now, symptoms of hyperthyroidism, which is common in Hashimoto's thyroiditis, also common in something called Graves' disease, which is a more significant thyroid autoimmunity, heart palpitations, inward trembling, increased pulse even at rest, nervous and emotional, and insomnia. Also like greasy skin and more like frequent bowel movements, more like IBS. So what's interesting about this? Well, let's say you have hypothyroid symptoms and you started taking iodine. A person could go from hypothyroid to hyperthyroid, okay? And so they could go from being depressed and constipated to feeling kind of good in the middle, and then starting getting to hyperthyroid symptoms, which is irritable bowel syndrome, excessive weight loss, really nervous and emotional, and having insomnia. And I've seen this happen with clients that are in iodine supplementation. And I would suggest that a lot of you that are taking iodine supplements right now that have had mysterious hair loss, just go look at the supplements you're taking and identify if you're taking this. That's a little bit about thyroid symptoms. So let's just look at what the literature is saying, or some evidence of what the literature is saying related to thyroid autoimmunity. So we already determined that this particular supplement has 10,000 the RDA in it. Okay, that's 15 micrograms, and the dose recommended is 15 milligrams, and the dose that's recommended is 150 micrograms. So just a quick diversion there. These are some cool links that I'm looking through here. The conversion of micrograms to milligrams is there's 1,000 micrograms in a milligram. So that's why this number is so high. So this is 10,000, 5 milliliters is 10,000 days worth of iodine. Now, again, how is this being recommended? 5 milliliters in 100 milliliters of water or juice 2 to 3 times a day, or as directed by a healthcare professional. Okay, so even if this worked for COVID, which I'm not saying it does, okay, how long are people taking it? A lot of people just hear that and they're freaking out. They get a symptom, they start taking this stuff, or they take it and then they don't know when to stop taking it. All right, so what happens in chronic use of iodine in excess of the RDA? Okay. So consequences of excess iodine. Here's one article This article was written in 2013, a little bit newer than 1961. Hypothyroidism or hyperthyroidism as a result of supraphysiological iodine exposure, i.e. 10,000 milligrams a day, or excuse me, 10,000% the RDA a day, like 3 times a day. So 30,000% the RDA in a day for how many days? Might be either subclinical or vert, and the source of an excess iodine might not be readily apparent, okay? So basically what they're saying is it's not going to be obvious that iodine is causing this. However, a person can get hypothyroidism, i.e. depression, constipation, hair loss, cold hands and feet, increased inability to gain weight and make it harder to lose weight, or hyperthyroidism, which could actually become a thyroid emergency called a thyroid storm that could send somebody to the hospital for a stroke. Might be considered a little bit of an issue if they have Graves. All right, so if they have Graves, they certainly don't want to be taking any iodine. Okay, let's look at another. Graves is that really excessive thyroid autoimmunity. Okay, let's look at another one here. Iodine intake and chronic immune thyroiditis, a comparative study between areas in Greece. In conclusion, in the present study, we clearly indicate that increased thyroid autoimmunity is positively associated with increased iodine intake, as well as the female gender. So women get double whammied here. Okay, here's another paper. This took me like 5 minutes to do just a Google search of thyroid autoimmunity and iodine. Okay, so this is saying too much iodine and thyroid autoimmunity. An update, this paper was 2021, as opposed to a company using research from 1961. Okay, by the way, I got off track. Imagine that. Okay, here it is. Micronutrient deficiency as an underlying cause of disease. Let me see if I can find that paper. Okay, here's the paper. I went and looked at it. Okay, so this paper was written in 2003. Okay, and here's what it says. Iodine deficiency in pregnancy has long been linked to cretinism and possible fetal wastage. Well, that doesn't sound good. Recognition of this has led to highly effective programs for making iodized salt available in iodine deficient areas like the United States. Okay. As a result, while more than 2 billion people live in areas that used to be iodine deficient, it's estimated that the current burden of disease caused by iodine deficiency is only 0.2%. 0.2%. 0.2%. So of the 0.2% of people in the world that might contract COVID, even if this was effective for that, likely it would be unnecessary because they already have enough iodine in their body. Can you see where I'm going with this? Okay, so I'm just looking at the research that this company, I'm not picking on this company, okay, but I'm just saying that most people actually have adequate iodine, and that iodine actually can cause autoimmunity in people that already have enough iodine. Okay, so here's what that paper said. The main question we address in this review is the clinical relevance of the possible effect of autoimmunity exerted by the use of iodine-enriched salt. They're not even talking about taking iodine. Okay, they basically said, look, we started iodizing the population. Now what are we seeing? Okay, basically what they are seeing, okay, previous iodine status of population seemed to influence the functional thyroid responses to an increased iodine intake and possibly development of thyroid autoimmunity. Basically what they're saying is if they add enough iodine already, that there's a link to too much iodine and autoimmunity, okay? Moreover, the prevalence of thyroid antibodies regarded as a hallmark of autoimmune thyroid disease, aka Hashimoto's or TPO or thyroglobulin antibodies, if you've done labs, varies between populations under the influence of genetic and environmental factors, meaning there's other factors that make people susceptible other than just iodine, okay? And the presence of thyroid antibodies does not always coincide with the presence of thyroid disease. So some people can have thyroid antibodies, but they don't progress to hypothyroidism, okay? But most will, it's just a matter of time. In addition, the incidence of autoimmune diseases shows a general increasing trend in the last decades. For all these reasons, available data are quite heterogeneous and difficult to analyze and compare. However, in conclusion, the available data from long-term population surveys show a higher than adequate population iodine intake due to a poorly controlled program of iodine prophylaxis could induce thyroid dysfunction, including thyroid autoimmunity, mostly represented by a euthyroid subclinical hypothyroid autoimmune thyroiditis. That's a mouthful. Basically, what it's saying is these people have antibodies, but they don't have symptoms. But that is the first phase in autoimmunity. Now, what if this person doesn't develop thyroid symptoms like depression, constipation, inability to lose weight, hair loss, or hyperthyroid symptoms like rapid heart rate, more emotional, greasy skin, IBS, increased weight loss, but they just develop brain fog, lack of motivation, and like, for example, sick person syndrome, okay, which is a well-known syndrome amongst people that have neuroinflammation. Increase in cytokine signaling due to a autoimmune antibody production south of the brain can create symptoms in people north of the brain if they've had a concussion. So those of you who have suddenly started getting brain fog after taking your supplement with iodine in it, please consider stop taking that, throwing it in the garbage, and let's just leave it at that. Okay, now, the next study, okay, I asked Google how many people in the United States actually have thyroid autoimmunity. Okay, my understanding was it was 10%. Actually, 5% of people in the United States have thyroid autoimmunity, and about 5% are estimated to be having it and undiagnosed. So it is about 10%. And people that overdo thyroid supplements or thyroid touted supplements like iodine are more likely to develop autoimmunity. So this is going to be another one of those conditions that goes through the roof after COVID because so many people are taking supplements with iodine. Okay. So what does thyroid autoimmunity look like? Let's come back to that. Oh, I just did one quick search on iodine consumption causing Hashimoto's, which is thyroid autoimmunity. And of course, there are numerous papers, all that come up. If I did this in PubMed, you would see hundreds, if not thousands of papers on that topic. So it's not just like a small bit of research where I'm cherry picking research. This is really just a passionate topic I have because so many people have autoimmunity and they don't know where it comes from. They're told it's genetic. Yes, it's genetic. And if you take a boatload of autoimmune stimulating substances, then your genes are more likely to become active. Okay. This is that paper from 1961 that I read related, that was quoted on the supplement website. Okay, so let's just go take a quick look. One of my favorite tests is Array 5 from Cyrex Labs, and it looks at antibodies to different tissues. There's 3 phases of autoimmunity. The first phase is antibody production, but no actual symptoms. The second phase is antibody production and then symptoms. So let's say you had taken too much iodine, and as a result, you developed thyroid autoimmunity where you started attacking this enzyme, which is what responsible for making thyroid hormone. You take iodine and a protein and glue them together with this enzyme to make thyroid hormone called T4. Okay, that person can develop a gluten sensitivity as a result of it. That person can develop sensitivity to exercise, meaning they start falling apart when they exercise, or they start falling apart when they get stressed. They can develop little white spots on their skin called vitiligo. They could develop Hashimoto's thyroiditis. They could develop a more serious thyroid condition called Graves' disease, and they could develop autoimmune thyroid disease. Okay, that's what the research is saying. People that take more iodine than necessary can develop thyroid autoimmunity, and this is the enzyme that gets attacked in thyroid autoimmunity, and these are the conditions associated with that. Here's some more research around that. Okay. Autoimmunity occurs when antibodies against TPO cause gradual destruction of follicles in the thyroid gland. So you saw earlier that paper that described euthyroid Hashimoto's, meaning, oh, they're just antibodies, it doesn't matter. Okay, well, it does matter because it does cause gradual destruction of the thyroid gland, and eventually a person would need to take thyroid hormone. And it would be nice if they didn't have to do that, particularly since other literature shows that if a person has one autoimmune condition, within 6 months, if they don't get that horse in the barn, so to speak, they're going to have another tissue that gets targeted. Okay, so this is not a small deal at all. And what does autoimmunity look like? It looks like depression, fatigue, joint pain, vertigo, dizziness, lack of motivation. It looks like learning disabilities in children. It looks like fatigue, weight gain, basically all the stuff that basically doesn't kill you necessarily, but just makes you feel like crap, causes you to go to doctors, and then doctors basically say you're just getting older until it's enough that you can get treated. And then once you get treated for it, which means you're in the symptomatic phase and you have enough tissue destruction to be diagnosed in the medical model, then you're put on immunosuppressive medications for the rest of your life as a primary strategy. So why am I somewhat freaking out about all the people that I know that are considering or already taking 10,000% the RDA of iodine? It's because I don't want to see those people develop thyroid autoimmunity and then not understand that they actually have thyroid autoimmunity, end up triggering their pre-existing concussions, end up triggering their genes to make more antibodies to more tissue, and then end up 5, 10, 15, 20, 30 years down the road battling something that they don't have to battle because nobody ever told them. So I hope you enjoyed this video, and hopefully it makes sense to you. And if you are experiencing more depression, more anxiety, more, not necessarily anxiety unless it's hyperthyroid, okay, but more depression, more hair loss, more constipation, cold hands and feet, inability to lose weight or weight gain during this pandemic, and you're also taking a ton of iodine, I would strongly consider not doing that anymore. And if you already were experiencing hair loss, depression, inability to lose weight, fatigue, easily gain weight, or any combination of those things, and you've been running a ton of thyroid lab tests over the course of your lifetime, you've been told your thyroid labs are normal, have your doctor run a TPO test. That's this. If it comes back elevated, then you have now gotten yourself into, unfortunately, thyroid autoimmunity. Okay, now, here's the good news about thyroid autoimmunity. There is a lot that can be done when a person has autoimmunity. There is no cure for autoimmunity, which is the bad news, but remission is possible. So as much as I'm concerned at the level of people that are supplementing themselves potentially into harm, there is a lot that can be done should that already be happening. And so I don't want you to freak out. I just want you to stop taking the iodine.